Ever wondered how peripheral artery disease and insulin resistance might be connected? Well, you're about to find out. Welcome to the Victory Education Lounge. Today we're diving into part 85 of our series, exploring the crucial connection between peripheral artery disease, PAD, and insulin resistance. Before we begin, please take a moment to like this video. Subscribe to our channel and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. In this exciting exploration of the intricate connection between these two conditions, peripheral artery disease, or PAD, is a circulatory issue that results in reduced blood flow to the limbs, particularly the legs. Insulin resistance, on the other hand, is a metabolic disorder where your body's cells don't respond effectively to insulin, leading to elevated blood sugar levels. At first glance, these conditions may seem unrelated, but extensive research suggests a strong link between them. Understanding this connection can provide valuable insights for managing and potentially improving both conditions. So, buckle up as we delve into this fascinating world of medical research, unraveling the intricate interplay between peripheral artery disease and insulin resistance. So let's delve into the fascinating world of medical research and uncover this intriguing connection. To understand the connection, let's first understand what peripheral artery disease is. Peripheral artery disease, often abbreviated as PAD, is a common circulatory problem in which narrowed arteries reduce blood flow to your limbs. Now, when we say narrowed arteries, we're referring to a process called atherosclerosis, where plaque, a sticky substance made up of fat, cholesterol, calcium, and other substances found in the blood, builds up in the artery walls. Over time, this plaque hardens and narrows the arteries, restricting blood flow to the body's organs and tissues. Now, why does this matter? Well, when we're talking about PAD, we're often referring to reduced blood flow to the legs. This can cause symptoms like leg pain when walking, numbness or weakness in the legs, sores on the legs or feet that won't heal, and even changes in the color of your legs. It's important to note, however, that not everyone with PAD will experience these symptoms. In fact, many people with PAD have mild or no symptoms at all. So what causes PAD? As we've mentioned, the main cause is atherosclerosis, but there are other factors that can increase your risk of developing PAD. These include smoking, diabetes, obesity, high blood pressure, high cholesterol, and increasing age, particularly after reaching 60 years old. The implications of PAD go beyond leg pain and discomfort. You see, if left untreated, PAD can lead to critical limb ischemia, a condition characterized by chronic inflammatory injury and cell death, which can lead to limb amputation. Moreover, because atherosclerosis isn't limited to the legs, people with PAD are at higher risk of cardiovascular events like heart attacks and strokes. Now that we're clear about what peripheral artery disease is, let's move on to insulin resistance. Insulin resistance, another medical term that sounds complicated, but it's really not. It's a condition where the body's cells don't respond as they should to insulin, a hormone that regulates the amount of glucose or sugar in our blood. This resistance forces the pancreas, the insulin-producing organ, to work overtime, churning out more insulin to keep blood sugar levels in check. But why does insulin resistance occur? Several factors contribute to this. A sedentary lifestyle, poor diet, obesity, stress, and even lack of sleep can all play a part. It's also important to note that insulin resistance can be a precursor to type 2 diabetes, a chronic condition affecting millions worldwide. Now let's talk symptoms. Unfortunately, insulin resistance often doesn't show any clear signs until it's well advanced. Some people, however, may notice conditions associated with insulin resistance, such as darkened skin patches, often seen on the neck or in the armpits, a condition known as acanthosis nigricans. But how does insulin resistance impact our health? Well, when your cells resist insulin, glucose builds up in your bloodstream instead of being absorbed. Over time, this can lead to higher than normal blood sugar levels, triggering a host of health issues, such as heart disease, stroke, kidney disease, and yes, peripheral artery disease, which we discussed earlier. And if you're wondering if there's a way to test for insulin resistance, yes, there is. Doctors use a variety of tests, including blood tests to measure glucose and insulin levels, as well as the HOMA-IR test, which assesses insulin resistance specifically. Now that we have a clear understanding of both conditions, let's explore how they are connected. Now comes the exciting part, discovering the link between peripheral artery disease and insulin resistance. It's like piecing together a jigsaw puzzle, where each piece contributes to the bigger picture. So, let's delve into this intricate relationship. Both peripheral artery disease and insulin resistance are conditions primarily related to lifestyle factors and aging. Now, you might be wondering, how do these two conditions intertwine? Well, it's a bit of a double-edged sword. Insulin resistance can lead to the development of peripheral artery disease. How so? Well, when your body's cells resist insulin, your pancreas produces more insulin to compensate. This excess insulin thickens your blood vessel walls, narrowing them and reducing blood flow to your limbs, a classic symptom of peripheral artery disease. On the flip side, peripheral artery disease can exacerbate insulin resistance. When blood flow to your muscles is reduced due to narrowed arteries, glucose uptake is hindered. Your muscles need glucose for energy, but if they can't get enough, your body thinks it needs more insulin, leading to increased insulin production and insulin resistance. And the evidence to support this connection? Numerous studies have drawn the link. One such study, published in the Journal of Vascular Surgery, found that among patients with peripheral artery disease, a staggering 70% also had insulin resistance. Another research from the American Heart Association showed that people with insulin resistance are up to twice as likely to develop peripheral artery disease. This interplay between peripheral artery disease and insulin resistance is like a vicious cycle, each condition worsening the other. And while it may sound daunting, understanding this connection is the first step towards managing these conditions more effectively. Quite surprising, isn't it? But the connection is undeniable. Knowing the connection is just the first step. What can we do about it? Now that we understand the link between peripheral artery disease and insulin resistance, let's delve into the various strategies that can help manage and prevent these conditions. Firstly, regular exercise is a key player. Incorporating both aerobic and resistance training can improve insulin sensitivity, promote better circulation, and alleviate PAD symptoms. However, it does require a consistent effort and time commitment, and some PAD patients may experience pain during exercise. Next, we have dietary changes. A heart-healthy, anti-inflammatory diet can improve insulin sensitivity, reduce inflammation, and support cardiovascular health. Yet, it requires significant lifestyle changes and meal planning. For smokers, quitting tobacco use can reduce inflammation, improve circulation, and benefit overall health. However, nicotine addiction can make this a particularly tough battle. Medication management in collaboration with healthcare providers can effectively control symptoms and slow disease progression. But it's important to remember there can be potential side effects and the need for ongoing medical supervision. Weight management or maintaining a healthy body weight can reduce insulin resistance and improve circulation. This too can be challenging to achieve and maintain. Regular health screenings can allow for early detection and intervention, though they can be time-consuming and potentially costly. Stress reduction techniques can help regulate hormones and improve overall well-being. But learning new skills or making lifestyle changes may be required. Good foot care is essential, especially for those with diabetes, to prevent complications and promote early detection of issues. However, it requires daily commitment and may necessitate professional care. Regular blood sugar monitoring can help maintain optimal blood sugar levels, potentially benefiting vascular health. Yet, it requires ongoing effort and possibly medical supervision. Lastly, ensuring adequate fluid intake supports overall circulatory health and may help manage blood sugar levels, though it may be challenging for those with certain health conditions or fluid restrictions. As you can see, managing these conditions involves a holistic approach, but it is definitely achievable. We've covered a lot today, so let's summarize. We delved into the intricate connection between peripheral artery disease and insulin resistance, two conditions that, though seemingly unrelated, are deeply intertwined. We learned that consistent exercise, dietary changes, smoking cessation, medication management, weight management, and regular health screenings can all play a crucial role in managing these conditions. Stress reduction, foot care, blood sugar monitoring, and adequate hydration are also pivotal. Each strategy has its pros and cons, but together they form a comprehensive approach to tackle both conditions. It's a lot to take in, but remember, every small step towards better health counts. Keep exploring, keep learning, and keep making choices that support your well-being. Remember, knowledge is power, Stay informed and stay healthy. Before we conclude, I want to emphasize that the information in this video is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician. Your healthcare team knows your individual situation best and can provide personalized advice. In summary, the link between peripheral artery disease and insulin resistance highlights the interconnected nature of our body systems. By addressing both conditions through lifestyle changes, medical management, and proactive health measures, we can potentially improve our overall health and quality of life. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Until next time, I am wishing you health and vitality.